Stress, Coping, and Health, Social Support, and Coping with Stress.
Researchers in the past began examining the potential for smartphones to be used as tools for social support. It was found that texting was an appropriate tool for intimate disclosures and that it buffers the impact of stressors as well as contributes to well-being. One study, for instance, found that positive moods improved in adolescents as they had fewer symptoms of anxiety and depression. Another study, however, found negative associations between texting or instant messaging and well-being, specifically finding lower life satisfaction, interpersonal stress, depression, attention deficits, hyperactivity, and conduct disorder.
Our research question for this study consists of 3 parts. Is texting associated with our well-being? Can texting improve our well-being? And finally, does texting assist in the coping of stress for young adolescents?
Our hypothesis for the study includes the belief that those who text will have 1. Improved positive mood, 2. Lower perceived stress, 3. Higher rate variability, and 4. We believe that results will be stronger for girls rather than boys, as girls are more likely to rely on social support for coping. Finally, we believe that adolescents who text will have lower stress levels than those who watch video games and those who did nothing.
In our study, we had a total of 130 participants, all from the United States, and they were studied in groups of 2. Our participants were adolescents, and the age group ranged from grade 6 to grade 9.
We recruited from Southern California schools and after-school programs using snowball sampling. Snowball sampling, also referred to as chain sampling, is when participants recruit new participants to be a part of a study. In our study, we asked 64 adolescents to bring a same-gender friend who they texted at least once a week.
Our tests were conducted in university laboratory spaces or at the child's after-school program or school. For our baseline test, the experimenter left the room and participants completed a demographic questionnaire and watched a peaceful 5-minute video of forest scenes. For our stressor test, 2 different experimenters entered the room. Both the subjects were told that to win a prize, they had to prepare a 5-minute speech on why they deserved to win. The experimenters wore lab coats and were trained not to smile and pretend to record the speech. They took notes and prompted participants to continue if they finished early. Participants then completed a 5-minute verbal subtraction task in which they subtracted by 3 starting from 1022 as quickly and as accurately as possible. If they made an error, they had to begin again. For our experimental manipulation activity, the original experimenter re-entered the room and asked participants to wait while they prepared for the next participants. Adolescents in the texting condition were given a smartphone from the laboratory and told to text their friend through Google Hangouts. For the passive phone condition, we wanted to assess the impact of simply being distracted by a smartphone. We selected a bricklaying video to help free the effects of texting from simply using a phone. We did not include an in-person condition. Participants in the no activity condition were simply told to wait while the researcher prepared for the next session.
The participants who took part in texting a friend and telling them why they are upset reported to feel better afterwards, less stressed than before. Compared to the group passive phone, who are those who were playing on their phone instead of texting anyone, reported to be less happy and stress levels were higher than the other groups. As well, with our group of participants who were not to be using a phone at all, instead they just did nothing, reported that they were also in a less happy mood and their stress levels were higher than the other groups as well.
results in graph form. As presented in the first half of the graph, it is shown that there is a big leap between those who were texting and those who were not in their mood. The orange texting group column is much higher than the others, proving that talking to a friend when troubled can help make a big difference. For the other two groups, it is shown that their moods are pretty similar to one another, and that they reportedly felt in a lower mood. Now, moving on to the second half of the graph, it is shown that stress levels for those who are not a part of texting is much higher than those who were, especially for those who had no distractions at all, reported the highest levels of stress.
Through this experiment, we can conclude that texting could help adolescents with stress. Those who texted friends have better moods and lower stress levels than those who watched videos and those who did nothing. Secondly, gender made no difference in our results regarding the levels of stress in texting. Lastly, those with parents that have a bachelor's degree had HRV, lower stress levels. We predict that this is due to having a familiarity with researchers in the university.
While conducting this experiment, we've discovered a few limitations, such as 1. There was one video pre-selected for each participant to watch. Moods would have been greatly increased if participants were able to choose the content of their preference. 2. The texting was not conducted in a natural setting. We've removed all other applications from the devices. Also, in a natural setting, one can be ignored or receive a negative response which would change the results grammatically.
For future studies, a recommendation would be to consider whether texting is more beneficial to some adolescents more than others. For example, if one participant has social anxiety, texting would be more beneficial to help them compared to participants that do not. Therefore, in future studies, the participants' level of social skills should be taken into consideration.